Welcome to the Philly Doctors. I'm Dr. Rubina Tahir, and the doctors are in. So let's get to know our panel this evening.
Hi everyone, I'm Dr. Zachary Tripp. I'm a chiropractor. I'm the owner and practitioner at Brewerytown Chiropractic. We are located at 26 in Girard in the Brewerytown section of the city. We treat pretty much anyone looking for chiro care, but we tend to have some specialties too. We focus on treating athletes, people trying to prepare for a sporting event. And we also work with pregnant mothers who are looking to have a healthy and safe birth. And we just prepare them for their birth.
Hi, my name is Nate Guyton. I am a CEO of S&G Enterprises and S&G Healthcare. I'm also a nurse by background. I have a master's in nursing and a bachelor's in nursing.
Hello everyone, I'm Dr. Joe Sabanko. I'm a dermatologic surgeon at the University of Pennsylvania and assistant professor. My practice is restricted to skin cancer and facial reconstruction, and I also have a focus on treating patients with signs of aging and photoaging, mostly minimally invasive procedures, laser procedures, and revisions of scarring.
Excellent. Welcome. So what happens when we get a group of doctors together with different backgrounds? Well, we're able to have a discussion about health trends, topics that are important to you, and what you can do to better your health. And it's the best city to do this in because the first hospital was built in Philadelphia. It was May 11th, 1751, the University of Pennsylvania Hospital, and it's actually the oldest hospital in the country. And so speaking of old, how can we maintain a youthful look? And that's what we're going to talk about tonight. So is there something that's off limits? Is there something that's too extreme? So by a show of hands right off the bat, any doctors on the panel tonight, have they done Botox? Let's find out. No Botox? No guilty? Dr. Sabanko, no?
I'm going to Jotox myself in maybe 10 years.
Okay, I'll join you. I'll come with you. Okay, so can you tell us a little bit about what Botox exactly is?
Yeah, so this is an interesting topic. I think as we have an aging population, many patients are concerned about sunspots and wrinkles and sort of sagging skin. And so I think one misnomer that often happens is when patients want to have some form of rejuvenation, they look for Botox.
Right.
And it should really be known that Botox has a specific function. It's been FDA approved for decades. It was initially used to relax muscles in patients who had neck dystonia, and it's been used to improve patients who had eyelids that kept spasming. And probably about 25 years ago or so, it was FDA approved for use to relax the muscles in the face. And it's those muscles that will give us the frown lines in the forehead, the crow's feet on the sides of the eyes. And it is an ideal treatment for a patient who has, in my mind, maximized other forms of skin rejuvenation. So I'll tell patients it's extraordinarily important that sunscreen be used throughout birth through indefinite period of time.
Okay.
And then there are topical treatments that are prescription strength retinoid creams. Some things that are often prescribed for acne can be used in older years to help very minor signs of aging, but once you start getting very prominent frown lines and creases,
Real wrinkles?
real
wrinkles.
real wrinkles, which I'll have patients who are in their 20s come in and request treatment. And
so will you use Botox on someone who's 20?
that's a great question.
And what do you guys think about that too? What's too young for Botox? Anyone?
40? Maybe?
40? 40?
40 is a
Okay.
good number.
Well, I just turned 40.
Not that you need it.
Right there.
Yeah, no problem.
But I think in your 20s may be a little bit young, but at 40 I might use it. I might be at your office. See a little wrinkle there.
Let's do a Philly Doctors true or false. This will be interesting. So true or false, docs? According to the American Society of Plastic Surgeons, in 2015, there were 6.7 million Botox injections performed. What do you guys think? Everyone thinks it's true? Yeah, it is true. It is true. And those stats are even up from 2014. So why is it so popular? What kind of results are we going to get? And you know what? How long does it last? This is what I want to know.
So Botox is something that is a lunchtime procedure. It doesn't require much effort. It takes an entire week to see the effects, its full effects, but it only lasts about 3 to 4 months. Okay. And so it's something that for someone who's looking for a minimally invasive procedure but is fearful of having something with long effects, it's an ideal treatment.
Why does it take a week to get the maximum result?
making it very easy to understand that the product sort of allows the muscle to lose its neurotransmitter that causes it to contract.
Right.
So it takes a week for that to happen.
Okay. And who shouldn't get Botox?
So there's anyone who's got an allergy to the protein within it, anyone who's pregnant, anyone who has a neuromuscular disorder such as multiple sclerosis or Lambert-Eaton syndrome. So these are things that patients should disclose to their physicians if they have it, and also something that the treating clinician should inquire about.
Okay, okay. And do you guys think Botox is overused? Do you think that, too many people are doing Botox? Do you think it's a problem?
I mean, I don't think so. If they need it, and if they have these diseases that are really affecting their skin and it's really affecting their social life, then they should be able to get it.
Right.
I think a little bit. I think it's overused. I mean, I just watched the award show the other night, and you see the eyebrows up here and move, and I think to myself, that's just too much. Is that really too much?
Natay, you bring up an excellent point. Much of my research that I do at Penn relates to the importance of physical appearance. I think the simplest way to think about it is quoting Deion Sanders. He said, "If you look good, you feel good," and that's I would think many folks would agree. And we're trying to identify if these treatments will improve quality of life and self-esteem. The point that you make about eyebrows being raised or folks looking frozen,
right,
that's not an effect of the product, it's an effect of the way in which it's injected. So I would encourage anyone out there, if you're going to seek treatment, ensure that you're having it done by a clinician who is experienced, who has an anatomic knowledge that is extensive, and is using FDA-approved product. So these are the ways that you can minimize the plastic appearance.
Wow, that's interesting. I didn't even know that. I didn't even know that there was a bad way to inject Botox.
Oh, absolutely. Any cosmetic procedure that is being done is operator dependent. And so if someone has an adverse event or an outcome that is unfavorable, it may not necessarily be primarily due to the product that's being used.
Okay. And what are the most common areas that you will inject? Around the eyes?
So I think Botox, the simplest way of thinking about it is Botox is great for the upper third of the face. So any wrinkle that you have at the eyes or above the eyes, it will work on the brow, the forehead lines, and the crow's feet. It can be used in the lower third of the face, but in patients who have more prominent signs of aging, it's more of a volume loss and a gravitational descent, not necessarily related to the muscular contraction. So we can improve some of the frown lines in the lower third of the face, but really, especially in folks who are just starting out at a younger age, it's the upper third of the face.
Okay. All right, it's time for another Philly Doctors True or False. Here we go. True or false? Avocados are not a great source of antioxidant carotenoids and do not provide significant protection for your skin from environmental damage that leads to fine lines, wrinkles, and other visible signs of aging.
False.
False.
False. Yeah, they're good tonight. You guys are on. This is true. So the fact is that high amounts of carotenoids in your diet have been shown in the research to improve your skin's density, right? And so we want to have that tone, that thickness, and that tone. So how many people on the panel will use a mask? Has anyone made their own mask? Did you make your own mask? What have you made?
Avocado.
Avocado.
Yes.
And
For the hair and the...
And the guys can do it too, come on. All right, so avocados are really great for the skin. And another popular product is the collagen mask. So there's some alternatives. And what do you think about alternatives to Botox? Like, are these some of the things that you probably would suggest to try first?
So this is where I think I have a controversial opinion.
That's good.
I obviously have a relative conflict of interest, so I perform these procedures. These procedures cost money, and what I can explain to a patient is that they actually have a positive effect that is visible. I can show them a before and after photo and have the line visibly reduced. So if someone is attempting to spend a significant amount of money on a topical product that is not a topical retinoid, the likelihood of them seeing a significant improvement is negligible. And so I'll often counsel patients, if you're looking to seek an improvement that is very visible, you're better off saving your money. Now, for patients who are looking for minor improvements, there's nothing wrong with going to CVS and purchasing masks and using them, but
the routine is fun. And I feel like maybe the routine can kind of contribute to like stress management, relaxation. So how do you guys feel about routines? Like there's sleep routines, right? Dr. Zach, you think sleep is really important when it comes to anti-aging?
Having a routine that's going to help you get your maximum sleep every night is absolutely vital to anti-aging. especially we want to have enough melatonin produced when we are sleeping. Melatonin is an antioxidant, it has some very strong antioxidant properties, especially for our brain. And there are ways that we can produce melatonin naturally without having to take a supplement. And once we hit age 40, it's harder for our bodies to naturally produce melatonin, so sometimes supplementation might be a route that you want to go. I don't know if anybody out there is 40 or above and starts to notice they don't sleep as well, they get a little anxious, sometimes they have some more racing thoughts. So sometimes after 40 we do tend to kind of need more of a supplementation, but there are foods and tricks that you can do to help you produce melatonin when you're sleeping, like keeping the lights off. It's only released in darkness. So if you're sleeping with TV screens, cell phone lights, anything like that is really going to inhibit you from producing melatonin, and it has a wide variety of health effects. So we really want to get some crucial sleep. About 8 hours a night would be a good number.
I agree. Sleep is really important. We've got to rejuvenate.
Yeah.
What do you feel?
There's two routines that I really take advantage of and kind of commit to. One is meditation and two is yoga.
Okay.
And I really had this acronym for my life. It's called MY, because you need my time, right? So meditation and yoga. And it's been published in research from UCLA that meditation does help combat insomnia.
Right.
And so, we have a lot going on in our lives, and, we want to look good and we want to feel good, but in the inside, it's kind of tackling the inside. How good do we feel? How youthful do we feel? And so that's where I use the meditation at least twice a day, bring my mind and body into subjection and really still myself and be mindful. And then I use yoga because I'm still active, right?
Yeah.
Sometimes, you meditate and you can fall asleep. Or you're meditating and you say, I'm sitting there and I can't bring my mind or body down. So I use yoga as an active form of balance, and that really helps me. And it helps me stay very energized, very energetic. I'm out there with my kids and I can restore myself. And then, I'm looking good, and then I feel good. And I think that's what's up.
And it's good, because if you have a family, right, and you want to practice things, for health, it's a good way to incorporate the kids so you don't feel so much pressure, you don't have time to do something. So it's good to incorporate these things into lifestyle. Where's your favorite place to meditate?
In my closet. In my closet. Okay, so nobody knows this, Dr. Rubina, but I can tell you guys.
Everyone's gonna know
I can tell you. So in my clothes closet, I separated the clothes. I moved them out the way, and I created this meditation room inside my closet. So I have books that'll help me center myself. I have notes, and my husband said this is like Carrie on Homeland. I have Post-its all over my closet, from the ceiling to the floor.
Nice.
And it helps me bring back to thoughts in my mind.
Right.
And I go there every morning and every night. Now, when I first started, it was about 5 minutes or 10 minutes.
Okay.
And now I can be there for an hour.
Oh, wow.
But I schedule time in the morning before
Yeah.
I do anything to do that. And then at night, I have to bring myself down, or else I wouldn't be able to go to sleep. I'm so wired up.
Fair enough,
So I take time to do that. Not an hour at night, but definitely an hour in the morning, at least 15, 30 minutes at night.
So what's your best advice for someone who has never tried meditation? What's the best thing you can suggest for that first minute?
Just get into a place where you feel comfortable and safe.
Okay.
Right? And get away from everyone, right? So even though I have kids and I have my husband and my house is always full, my closet is a place no one can enter.
Right.
So it's always a joke when I come home and everyone's hiding in my closet, right? So find a place where you can definitely be by yourself, you can be alone, and you have that time, and start for about 5 minutes. Put a timer on your cell phone.
Right.
Right?
Yeah.
5 minutes, and try to increase it every day.
That's good. Dr. Zach, do you meditate?
Yeah, I try to meditate. I usually don't do it in my closet. I might need to find a better place. I actually try, I don't know if you have some advice on this. When stuff is like most hectic and there's a lot of stuff going around me, sometimes I try to meditate then, and I feel like it kind of like increases my ability to let go of things and focus sometimes. But definitely gonna have to try it more in like a quieter area. Yeah.
Right, but Dr. Zach, you bring up a great point, because sometimes you're traveling, right? You're in a hotel, you travel for business, and you can't be in your closet. So yeah, use your own space, right? And you're talking also about mindfulness, right? Being mindful and present in the moment, that'll help you clear your head and make better decisions. So definitely, you don't have to be in this particular space.
Yeah.
You could be in your car, you could be in your office, but it does work.
It's about routine, right? And
Yeah.
consistency. I think that people need to be aware if you're trying something, not just one day, not just 1 week, but really give it a go for a couple of weeks, right? Even if it's like diet, exercise, food, right? It's really important.
At least 21 days.
There you go, 21 days.
I tried I tried the P90X yoga meditation for like a week, and the guy starts out by saying, if you give yourself just a couple of minutes, you'll be the clearest mind ever. In my mind, it's like a Guns N' Roses concert
Yes.
going on.
Yes.
Like I can't shut things off. So this has been really valuable to hear all of these tips.
21 days.
Yeah.
Do you meditate?
I pray. That's sort of my
Yeah,
way of
fair enough.
channeling energy, but I go to the gym every day too, which is a good way to blow off steam. But I do have my Drake and other things going on in my headphones, so it's not true meditation.
Yeah, well, Drake's good. He burns some energy. He's also Canadian, just saying.
Six-sided?
Yes. So, what's your favorite exercise? Are you running, elliptical? What's your go-to?
As I get older, I get more and more afraid of hurting myself. So all that high-intensity interval training, CrossFit, is something that I'm getting more skeptical of. But I do love to run. That's sort of where I hit my euphoria. I did a 50-mile bike race recently this past week. I got lost, so I only wound up doing 35 miles. But so I'm finding different ways. I think as I get older, I want to shift towards swimming because it's easier on the joints. But I think just having that prolonged sort of endorphin rush is it's a great way to blow off some steam.
And swimming's good too because you've got gravity working with you, so there's no pressure on the joints, right? And then what do you think about stress and aging? Do you think that there's a really big connection? I think so, but
there's definitely a correlation. Overall health, we know that there's cortisol release, and it stresses the body, which releases free radicals, and that can translate into poorer health as well as increased signs of aging. So certainly stress relief, while there's never been a good study that I've seen, it definitely is a logical conclusion to improve aging.
And so cortisol's a stress hormone, and it's actually been linked to like tummy fat, right? So we definitely want to turn off the stress response. So finding a way, whatever way you want to do it, to turn it off is the best way to go. So let's talk about diet now. Foods that are sources of antioxidants, since you were talking about the free radicals. So the free radicals are bad. We don't want them. We want them to be eliminated. So antioxidant foods. So Dr. Zach, what do you suggest when it comes to antioxidant?
I would say that you want to have a wide variety of colors in your diet. Fruits and vegetables, purple, orange, red, yellow. A lot of the pigments in the fruits and vegetables actually are very strong antioxidants, like lycopene in tomato, which makes it red, or carotene in a carrot that would make it orange. So make sure you're eating all your colors. It may sound a little silly or childish, but it's actually going to be great for your health.
Okay. And berries. Everyone loves berries,
Blue,
right?
yeah.
Blueberries, right? What's your favorite berry?
Strawberry.
Strawberries. Okay, so actually, cranberries, blueberries, and blackberries, they're the ones that are the most studied. Really good sources of antioxidants, as well, of course, like the spinach, the kale, so salad. Do you like kale salad? Anyone?
Kale changed my life 2 years
your
ago.
life?
I'm not beholden to anyone, but High Street on Market makes these kale chips when you
Kale
sit
chips?
down.
Yeah.
Blew my mind. Changed my life. So kale is good.
The first time I had kale, it wasn't good. It's grown on me, but kale chips sounds good.
Love it.
What about you? Love kale?
Sauteed kale with some garlic at least twice a week.
Oh.
For the kids, yes. Yes.
What about you?
I try to eat it raw. I try to maybe sneak it in a sandwich or in a bowl of rice, chop it up a little bit, but any way I can sneak it in. It's not the best tasting food in the world, I don't think, but I know it's important, so I try to definitely include it in my diet.
So we all have hectic schedules, right? So we should get away from the idea of, hectic schedule as an excuse not to eat. And you're in the operating room too, right? So how do you find that balance? How do you eat healthy on a daily basis? What are your tips and tricks?
I know my body, and I know that if I don't have my 10 a.m. protein bar, I don't have the energy to get through. Shameful to say, my lunch is usually just something on the go, but I make sure that I get a good, energizing meal before the gym in the evening.
Mm-hmm. What about you?
The same thing, just like Dr. Joe. I know my body, as you get older, you start to see the signs, You feel less energetic, you see the outbreaks, you see, so listening to my body and getting the proper meals is essential.
Mm-hmm.
Yeah, routine is definitely important when it comes to diet. Like you were saying, managing our cortisol levels. So one thing that I think is really important is eating a breakfast as soon as you can when you wake up, because our cortisol levels are rising as we sleep, and if you eat a good, healthy breakfast, especially high in quality protein, and try to avoid some sugars and carbs as much as you can in the first hour or two upon waking, it can really help lower those cortisol levels, and you feel the difference. You feel more energetic and focused throughout the day with a good, healthy breakfast.
Excellent. All right, so it's time for a true or false. So here we go, true or false. Vitamin C is necessary for collagen production and maintenance, but it's also a potent antioxidant.
True.
Everyone's true? Yeah, you guys, really good, so good. So do you take vitamin C daily?
I take a daily supplement, which includes vitamin C in there. I think it certainly needs to be ingested. You see topical products that are meant to improve signs of aging, and the way the skin works is that the blood vessels are, more than a millimeter into the skin. So if you put something topical on the skin, it's not going to get there. So I would encourage anyone who wants a supplement to do it orally.
That's an interesting point, because we were talking about the masks before, right? And it's a big market. People buy masks. I buy a lot of stuff. I want to try things. I think it's fun. I'll put anything on my face. But yeah, taking the vitamin C daily. Do you take a vitamin C daily?
Yes, and I think it's important for the audience to know as well, as you get older, and so check to see what supplements that are needed at certain ages. When you're 25, there's a certain supplement, and usually when you're between 35 and 45, start to introduce vitamin C and vitamin D into your supplemental diet.
What about you?
Yeah, I do take a vitamin C supplement sometimes. I try to get most of my nutrients from food, but with all the food available these days, especially in certain areas, we don't always have the best restaurants or food available, so I do take a vitamin C supplement, and like she was saying, it's good to know when you need what supplement. Like if you were out partying the night before and you're not feeling too good the next day, you might need to look at a B complex or a B vitamin for some energy and for some hangover recovery, but it's definitely important to know when to take what supplements.
Yeah, and I think it's important to meet with a healthcare professional and to kind of identify the demands of your day, right? Because this is what I tell people, and especially about sleep too. What's happening in your life? Like really being aware, right? Are you not feeling good? Maybe you didn't fall asleep the other night. Did you have an exam? If there's any students out there, you have to know your demands, right? And know what you're dealing with. So when you work with someone who's a professional, they can guide you and kind of set up, maybe you have certain things in your medicine cabinet that you can play around with. The other thing that people really like and always talk about when it comes to supplementation is the fish oils. So what do you guys feel about the fish oils? I like them. There's a lot of studies that show that they're really good for inflammation. So I kind of recommend them too for people who are looking for something on a daily basis. What do you think? Anyone?
Yeah, I love fish oil. I think it's really a crucial supplement. It's one of the things that I feel comfortable recommending to almost anyone who comes into my practice. Usually fish oil and magnesium are two big ones that I want people to address. Magnesium is also very important, and I think it's about like 80% of adult Americans now are they're not getting the necessary magnesium. They're deficient in magnesium. So magnesium supplements at night can also help with sleep, just like the melatonin. If you have a racing mind or you're not able to calm yourself down at night, magnesium would be a good option too.
Mm-hmm. Anyone else? Any other power supplements that anyone else takes? Sometimes I take coenzyme Q10. That's a good one for heart circulation. Anyone else have a secret they want to share? Their anti-aging secret? Anyone? No? Okay, let's move into the next topic, which I find to be quite interesting. Let's talk about fillers. So fillers, this is something you do. What do you guys think about fillers? I'm on the fence about this one. I feel like I would really try Botox once just to see what it felt like. I would want to know. Fillers. common. It's really common. But again, I feel like it can go too far. You know, some things I see. And so again, does that come back to being practitioner dependent?
Operator dependent. So, you know, we've been quoting statistics. The amount of money spent on cosmetic procedures in the United States last year was over $12 billion.
So much.
And you know, most of those procedures are minimally invasive procedures, Botox and fillers and lasers being the bulk of them. Fillers, when used appropriately on the properly selected patient, can do wonders. But the downside that you see, the folks that are overdone or injected in the wrong place, changes the features of the face. You know, we know that there's an aesthetic standard. The face should be vertically broken into fifths and horizontally broken into thirds, and there are certain proportions. And if you violate those proportions, it can make someone look not like themselves. So the one thing that I will counsel all the patients is I ask, you know, what concerns them, and then we talk about the aging process and how, I don't say we can reverse, but how we can augment that to either slow the process and refresh things. But what I think is important, and I'll always tell patients, and there are studies to support what I'm saying, fillers cannot take years off. Even surgery, when you have a facelift, they've shown photos of patients who have facelifts and eyelid lifts, and they ask just a layperson to look at those photos before and after and judge how many years have been reduced from the surgery, and it's no more than 3 years. So if you're 70 years old looking for a facelift, to an objective observer, you're not going to look 60. So it really is important to maintain an aesthetic standard and keep the patient looking like themselves. And the best compliment I'll get is when a patient comes back and says, you know, everyone says that I look refreshed. They don't know what I did. And
well, there's a big difference between refreshed and sometimes what we see. So what's exactly happening like with a lip filler?
Yeah, so that is the number one. And in fact, you know, the aesthetic standard varies. It's geographically diverse. So what is acceptable in Las Vegas and Miami is not acceptable in Philly.
Right.
What's happening in Philly? What's acceptable in Philly right now?
Well, what I will tell you is that if a patient comes back, I tell them, if you leave here and someone says, oh, Sabanco did your filler, I did not do my job, because it really should be something subtle and discreet that will give the patient self-esteem and a confidence boost. But if you put too much product in the wrong area, so if we're talking about proportions, the upper third of the lip should be no greater than the size of the lower lip, and in fact, the upper lip is in most appearances about a third, whereas the lower lip is 2/3. So if you violate those proportions, it gives you that duck or that pouty appearance that is, you know, it's one of the things that I do that is sometimes it's kind of like a curse. You know, you can spot things out in a second when someone walks on a bus or a train or down the street. And, you know, it's one of those things where someone seeking a cosmetic treatment really should see someone who is a seasoned professional, board-certified dermatologic surgeon, dermatologist, plastic surgeon, facial plastic surgeon, who is skilled in this, who knows the anatomy, knows the proportions, and that is the best way to avoid the duck lips and other adverse events.
Yeah.
Yes.
I didn't want to call it that, but I'm glad we went there.
Me too.
Okay.
Yeah,
Do we think that there's too much pressure
Yes.
to look good all the time?
Yes. I was looking at the U.S. News and World Report today, and it said we currently spend $400 billion on product, women.
Right.
And it said by the year 2025, it will be a $1 trillion industry, cosmetics. So yes, it's a lot of pressure. It is.
A lot of pressure.
I mean, you know, you got to get the grays dyed, and it is a lot of pressure.
It is. And I think, you know, our message today is to really focus on you and understand your demands. And if you're happy, then it doesn't matter. Just focus on your daily routine. Focus on what you love the most. I've had so much fun with the Philly Docs today. Let's do some final words. Dr. Sabanco?
I want to thank everyone here, Rubina, Kyrie, everyone at MyNEWPhilly. If anyone has questions or concerns, feel free to email me, joseph.sabanco@uphs.upenn.edu, and make sure you keep checking out mynewphilly.com. It's a great resource.
Just want to challenge the audience for 21 days. Think of yourself as meditation and yoga. Meditate for 15 minutes. Do yoga at least once a week for 21 days. And email us at MyNEWPhilly, or email me, TAYGUYTON, tayguyton@gmail.com, and let me know your results.
Since we're here talking about anti-aging, I would say the best advice I have about anti-aging is just not to worry about the aging and don't worry about too much. The stress is going to add to the aging more than actually trying to figure out how to stop it will. So it's natural, happens to everyone, just let it go.
Let it go. That's excellent. Let it all go. That's all the time we have for today. Thanks for watching My New Philly, where something is always new and everything is always Philly.